Hi, I am here to talk about needle exchange programs in the Darke County community. Did you know that a person that uses cocaine will inject themselves up to 20 times per day on average? I am here to persuade the residents of Darke County, Ohio, that a needle exchange program would be beneficial to working towards maintaining a healthy community. My name is Mark Bargy, and I am an Edison State student. I am a science major who is very interested in the health of our community. According to Health Magazine, just last year in a small community of 4,200 people in Indiana, there was an HIV outbreak that led to 169 people being diagnosed with HIV and 80% of them also being diagnosed with hepatitis C. The spread of disease was traced back to residents dissolving prescription painkillers and injecting themselves. According to a report produced for the Ministry of Health, the best estimate is that needle exchange programs reduce the transmission of HIV by 1/3 and save $4,000 in healthcare costs for every $1,000 spent. Needle exchange programs also reduce the incidence of other diseases such as hepatitis C, and they clean up our community by encouraging those who use injectable drugs to turn their dirty needles in. Many people think that the needle exchange programs will increase the number of used needles laying around their community, but research shows us that exactly the opposite actually occurs. Through my volunteer experience at the local Darke County Health Department, I gained a great deal of knowledge about the Darke County community. I met some people who have addictions and inject drugs. I established a human connection and can empathize with their situations, and I learned that there are a lot of people in this situation. There is such a need that just this year, a Vivitrol program has started in Greenville, and Greenville has also been on the news for dirty needles laying in the park. According to Carrie Shuttleworth, infectious disease nurse at the Darke County General Health District, drug use is on the rise, diseases are on the rise, and dirty needles laying around in our community are also on the rise. As caring citizens who wish to maintain a healthy community, we need to support the implementation of a needle exchange program because of increasing drug addiction problems. Helping those in need, decreasing the spread of disease, keeping our community clean, and being proactive towards an increasing community problem is important to maintain a healthy community. Needle exchange programs help those in need by providing users with free, clean needles, connecting the users with other medical providers if needed, and offering free counseling and education. Needle exchange programs are supported by the CDC and the National Institute of Health. The NIH estimates that in the U.S., between 15 and 20% of injection drug users have HIV, and at least 70% have hepatitis C. Dispensing clean needles can reduce the cases of diseases. Many individuals with addictions neglect themselves, and therefore they have other health issues. Poor health increases dependence on emergency room use, adding financial costs. Needle exchange programs are set up to help those who are drug users with other health-related services to improve their overall health. Counseling is offered at the needle exchange as a means of support for the user, their sexual partners, children, or neighbors. Nurses provide knowledge about physical protection and educate them on bloodborne pathogens, in addition to providing them with information on how they can protect themselves and others. Decreasing the spread of disease. The CDC has reported that there has been a 30% reduction in HIV cases among drug users because of needle exchange programs. The National Institute of Health published a statement on interventions to prevent HIV risk behaviors. That report concluded that the needle exchange programs show a reduction in risk behaviors as high as 80% in injection drug users. They also concluded that there was either a decrease in injection drug use among participants or no changes in the current levels of drug use. Decreasing the spread of disease is important, and we can also do that through keeping our community clean. Keeping our community clean by getting rid of dirty needles is important. In order to receive a clean needle, people who visit the needle exchange program must exchange a dirty needle for clean ones. Needles are not given without needles being returned in. It is a one-to-one exchange. This means that those in need will keep track of their needles and take them into the exchange them, instead of dropping them inside ditches, store parking lots, and in our parks where kids play. People will also clean up the community by looking for dirty needles to exchange. This will create less incidents and accidental needle sticks that spread diseases and a safer community for everyone to live in. Cleaning up our community is important, and being proactive is also very important. Ignoring an increasing drug issue is not going to solve our problem. It will just allow problems to continue to escalate and drive citizens out of our community. Crimes and violence go hand in hand with drug use. People will not stay in our community if we allow the drug problem to define us. There must be a balanced approach of effort, enforcement, education, and treatment to fight this increasing problem. One aspect will not work without the other aspects. They go hand in hand. A needle exchange program, along with the already existing Vivitrol program in Darke County, will be an additional way to reach out to those in need, and it will be a way to show we care through a proactive and balanced approach. We've looked at the details, we've seen the effect on our community, we've seen the consequences of not acting. It shows us there is an obvious need for needle exchange programs. Needle exchange helps protect individuals from bloodborne infections like HIV and hepatitis by getting used syringes off the streets. They reduce the potential for drug users to share contaminated needle. Needle exchange programs also allow a person who injects drugs to bring back his or her used needle and/or syringe and receive free sterile replacements. Because the exchange is made in person, it offers healthcare workers an opportunity to engage with people who inject drugs and counseling for health, HIV prevention, and treatment referral. These programs also clean up our communities. Unfortunately, drug use has gotten so common that almost all of us know someone who is addicted or who has lost their life to their addiction. Imagine a world where this no longer exists. Imagine that we no longer see our police arresting addicts, we no longer see people losing their lives to their addiction, and we no longer see dirty needles in our community. This is the community we are striving for, where we can say we won the war on drugs. Progress will not come overnight. America's had a long and difficult struggle with drugs. It is not a war we've been fighting for a short time. We've been fighting it for 120 years. In the past, just like today, we see rising crime that accompany drug abuse. But we fought those problems through laws, education, and reaching out to those in need. This vigilance and dedication worked by World War II. Drug use has reduced dramatically, and we can do this again. But we have to take a stance and be proactive to make sure this occurs. To be successful, we must apply a balanced approach which includes not only enforcement but helpful programs. So think about it and support helpful programs that can work towards winning this war on drugs. It is in the best interest of our community. According to the Pope, no person is unworthy of our concern and help. Thank you for listening.